Hello, I am Dr. Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. Let's discuss today important topic like surgical abortion. Now, whenever a patient doesn't want to continue the pregnancy, she reaches the obstetrician and seeks for the help. There are two options available, medical abortion and a surgical abortion. Today we'll discuss more about the surgical abortion. So surgical abortion, commonly called as vacuum aspiration, is done for girls who are more than 9 weeks of pregnant or for early pregnancy where they are not ready to do the medical abortion. So it's a one-day process. It can be done up to 12 weeks of pregnancy. It's a daycare process where we'll be calling you early morning empty stomach. It can be done under short general anesthesia where you will be given certain injections with which the patient sleeps and does not feel any pain when we are doing the procedure. As the name suggests, it is vacuum aspiration. So a vacuum is created and the contents inside the uterus are aspirated so that the pregnancy is aborted. Now, after the procedure is done, patient is observed for 2 hours for the recovery and bleeding is observed. Once the patient feels comfortable, passes urine, takes some food, we discharge the patient. So, the advantage is it's a daycare process. It is done in one day and in next 3-4 days like your periods, the bleeding will continue and the bleeding will ultimately stop. The success rate is almost 99%, although there is a 1% chance that it could remain incomplete because ultimately it's a blind procedure. Facilities where ultrasound is available nowadays, ultrasound guided vacuum aspiration can be attempted, especially in high risk cases. So once this procedure is done, we always counsel some side effects of this procedure. Any surgery is never free of risk. Since it's a blind procedure, there are chances that there could be a uterine perforation, incomplete abortion, and excessive of bleeding during the process. However, in expert hand, these complications are extremely rare. A commonly asked question for all of us as doctors is, once this vacuum aspiration is done, will I conceive next time and will it be a normal pregnancy? So the answer is yes. Don't worry, even if you opt for vacuum aspiration as a method of choice for your abortion, nothing should go wrong. Once we do vacuum aspiration, the next periods usually start within 1 month or exactly after a month's time after we have done the procedure. So, once the periods start, it will be a regular phenomenon like otherwise you have had. Only concern is, in few cases, in next pregnancy, some placental issues have been identified. Sometimes the placenta can be little bit adherent because of this curettage procedure. Very rarely after this curettage, if there are intrauterine cynicae or some adhesions are formed, the periods will be scantier and it becomes difficult to conceive. However, most of the time this is a very safe procedure in expert hands and you should not have any problem conceiving and delivering a healthy baby in the next pregnancy.